make sure you guys actually read the recipe, because it'll tell you if there's a wrap, it'll say a 34 by 34 wrap, and if it tells you there's a back table wrap, it might be two different opening scenarios. One to open the iPad, and then the next drape to open or a back table type setup, okay? All these things are gonna come in different shapes and sizes. That's an iPad. Simple, nothing in it. All it has is a gown, a couple basins, a couple medicine cups, and maybe a eye drape. Okay? What does that mean? You might have to open everything that you see here on this setup. So if you work at that facility, you might need to open a simple pack, and then remember that I need to open 2B. I need to open a bipolar energy ESU type again setup. Now Ivan and Damaris were here in the morning. They showed me a setup, or she showed me, and he told me what we had before. They had to open pill pack items that what you guys see on this field. Okay, so it's nice when you get a pack that has everything, or you might need to open things separately. I think an ESU that had small packs, and you guys have to open items separately. Okay, so you might get a pack like that, or a pack like this, but everything's already there. And I showed you this pack the other day where it had an extra basin. I showed you guys how to take it off. It has all the extra stuff already there. So please, when you guys open the pack, make sure you read the ingredients. Okay? You guys have seen the new packs. When you get a chance, take a look at the new packs, and you'll see that it says everything that is in the pack. So if you read that it's not there, don't use that one. Try to find one that you can use for the case, okay? So give me some items now that might be on that recipe. Ready? Elliot, shoot. Kata, shoot.
Battery power Bluetooth.
A what?
Battery power Bobby.
Okay. Kind of a different power Bobby, right?
Yeah.
We're gonna get something like a, again, hot burner type one. I tell you it's battery powered or bipolar. So if it's not in your pack, what do you do?
Pill pack?
Go find one that's pill packed. Very good. Question.
Oh no, I was gonna say which one.
Okay. Right. Katie, what's another thing you might have? What's that? Wexel sponges. You guys must have Wexel sponges, right? Everybody at once. What do you have to have for every eye surgery?
Excel sponges.
No. What must you have for every eye surgery? BSS. We talked about this already. Basics off for every surgery. You guys will know why in a little bit. Every eye surgery, BSS, BSS, BSS. Wexels is all going to be doctor's preference, really. Also, some doctors like to use what instead of the Wexel. What do you? Daniel. Oh.
What?
April. The Q-tips. Guys, come on, replace one with the other. Don't go off tangent here, okay? And we're talking about sponges, so what does you replace it with? Not BSS. We need another type of sponge. In this case, in eyes being the cotton tip applicators, right? Q-tips is the name of the company. So start getting that away. Just like Bobby. Again, I know we like saying Bobby a lot, but it's actually ESU now. Bobby doesn't exist anymore. Bobby was on the machine, as now it says Valley Lab. They used to say Bobby. That's who used to make it. ESU. Okay. So, again, there's certain things that we need. So in that case, you look at that. There's a lot of items we need to fit. Okay. So if you guys want to challenge yourselves, open that pack and then try to open the stuff that we might need. We do have an abundance of stuff now. We found an eye kind of tray, a kind of supplies. Thank you for helping me. Supplies. So we'll pick those items as need be for your guys' cases. Definitely. All right. So, what else? All right. So you guys remember the aperture drapes? You guys know what an aperture drape is? You guys know what an end-size drape is? Okay. No, that's a U drape. It's an end-size drape. What does end-size mean? To cut. So the drape needs to be cut. So we have a fenestration drape. What does that mean? It has a hole in it. Aperture, smaller hole, usually with plastic around it. And then we have an end-size drape. It can have a barrier on it so that you need to cut into it. Okay? With eye surgery, you more than likely will get an end-size drape. Why? It covers things like eyelashes. Right? When we're prepping and we're doing stuff, sometimes the doctor will have you hold the eyelids open, and then we'll apply the end-size to the entire eye. So that way it keeps eyelids, eyelashes, and all these things out the way. Okay? If not, you're gonna have to sit there and hold these things. The speculums are to hold the eye hole open, not the eyelids and not the little eyelashes. Okay, that's what the end-size drape will be. Now let's think. If we don't have an end-size drape, give me some solutions, guys. What can you possibly put on that? Yes.
U-drape.
U-drape. No, U-drape is huge. For the eye, we're talking about the same thing for the eyelashes, right? Again, the end-size plastic is to cover the eyelashes and everything. So if we just have a hole, is the eye gonna close? How can we keep those eyelids open?
Retract.
You guys gonna do that the whole time? Oh, you guys are brave. You're gonna be holding these eyelashes back.
Retract.
Just give me a simple thing where you'll place on something to keep it still.
Retract.
Instead of using the lint, it's the other option that you put. But it's not. It's what you wouldn't use the lint for instead of the lint. Instead of using like a ray tip or a lap, you use the
The what cell? Is that right?
No, it's the bigger. The bigger.
No,
The
it's not an
instrument,
instrument.
the instrument holds the hole open to where your eye socket is, right? Your lashes. I mean, some of us have small ones, long ones, fake ones. You shouldn't have fake ones for surgery. All right, simple tape. Simple tape to hold those things back. And we do have sterile tape. Okay, little pieces of sterile tape. Anybody know what that's called? Steri strips. Yeah, definitely have some steri strips available. Some doctors might steri strip that stuff together because they don't have the inside strip. Okay, definitely we might use a steri strip. Some of you guys put that even on your case bill. What'd you do? Research. Okay, definitely. All right. Don't wait for me to tell you, guys. It'll go in one ear and out the other. Okay. Please continue to research. It's already gone. It's already gone over here.
That's why I'm recording.
Huh?
That's why I'm recording.
That's a recording? Okay. We'll see. Alright. So again, certain things that we might need in the tax, guys, please research as much as you can. Alright. So let's gather around real quick. I know already went over the instruments. Oh, you guys help me too. Get up. Don't hold up those chairs. Alright. Now, what I've set up over here, please be careful. Okay? This,
Sorry.
you guys know what this is, right? It's a caliper, right? Right now, I want you to imagine this to be the speculum because we don't have one. Okay? So in order, we have a speculum. Usually it's spring-loaded, kind of like the caliper is, but it holds the eye open. This is not going to hold because it doesn't have lips. Remember, speculums are going to have a lip, a hood, or some sort of retraction type access, okay? This one it doesn't, right? So this can't be used as a retractor. But we'll pretend there's a speculum here, okay? So when doing surgery, this is the way it's going to possibly go. These instruments are not 100% accurate. Some of these are old school, so we don't have the new school stuff. But as simple as it is, it's going to be this type of action. If you guys want to find out, again, ask Ivan. All right, he was actually doing a lot of eyes. Catherine didn't do so much eyes. Miranda didn't do so much eyes, but guess what? They can come here and at least try to survive during the eye case, right?
Yes.
All right, so because they know and they study this stuff because they got a CST very soon, right? All right, good. All right, so for cataract, do we need a hot pin? No.
No.
Okay, what are these possibly going to be applied to? Bleeders. Does the eye bleed that easy?
Yeah.
No, it actually doesn't. No, okay. Actually, it all can be corrected with a simple what? There's a bleeder. They're very small. It's more of a capillary type area. Okay, how are you going to be able to stop that?
Q-tip.
Q-tip. Apply some pressure, right? You guys have it. That happens all the time to you, right? Ouch! What do you do? Put some pressure. Some of you guys will sit there. Okay, don't do that.
So the around the eye won't bleed as much as like if you were to like.
Now we're talking about in the eye. This is
Okay.
cataract surgery,
Okay.
right? Around the eye, yeah, it becomes a little bit more vascular. Definitely, you'll need this guy. We're talking about the eyeball itself, okay, or the globe itself. Again, you won't be using a hot pen. If you will be going in the eye, you might be using the bipolar. It's more accurate, okay? But for cataract, you might not need these. Do you want to have them available? Of course. Okay. Going back here again, you want to have an eye speculum. After the eye speculum, the doctor might mark the eye. Okay, remember we talked about the pen and how they use an instrument, right? I even had a name for it earlier. What was that? Marker / holder?
Thornton ring.
A Thornton ring. Okay, look it up. Thornton ring. It's actually a little ring that some doctors place on the eye so they can hold the eye while they make incisions. Some doctors use it as a marking device so that they can mark where the incisions are going to be made. So they'll literally draw on that, mark it, and then the doctor can make incisions in certain areas. So let's talk about us being that poor facility that doesn't have the Thornton ring. So what can the doctor use? Anybody remember the names of these guys? The .12s or .5s, right? More than likely, they're going to be using, sorry, these are not in order. More than likely, they're going to be using the .5s, right? The bigger ones. So that they can hold on to the eyeball and they can go ahead and make their incisions as need be. I wanted to show you guys this one. This is the beaver blade with an actual, again, beaver handle, okay? It just looks like a very, very tiny 15 blade. When you guys are up here, please don't play with it. Please work with this individually. This can easily slip out of someone's hands because it's small and it'll cut you. And then from then we'll have to throw you into the dumpster in the back, okay?
What?
So hopefully that doesn't have to happen. I'm just kidding, I'll call medical care.
Okay.
But please don't play with this. Again, if I catch you playing with any of these devices, again, I will kind of push for your expulsion. And you do not play with these. You train with these. Yes.
What do you mean by play? Like, are we still allowed to like look at it? Like, oh no.
Okay, no. Pick it up. Okay? Pick it up, and I don't want you using it on anything. Okay? If you do use it on something, let me know first, okay? Beaver handle. This is the beaver handle. This is the beaver blade. Okay? How do you use this? With anything, when you guys have a blade, when you have a sharp, what do we use?
Needle
In
holder.
this case, we have the Castro Viejo, right? Just smack it right in there in the beefy part. Right now, you have more surface than you do your 10 blade and 15. And all you do is wrench this off. All you do is wrench this on. Hand tight. Okay, not Superman string tight. Hand tight. This thing will easily break. Okay, it's as easy as that. Okay, and also give it a quick check if you need to be. Always use instrumentation to check. Never use your bare hands. Okay. Remember, this action leads you to go back. If you're doing this, you might stab yourself. Okay. So, don't do this. Do this. Okay. Name of this needle holder?
Castro
Very
Viejo.
good. All right.
Machine
So
Viejo.
this one will not be used for cataracts, but I did want to show you guys this for eyes. This will be used on, again, like a chalazion, right? Some sort of eye mass, or working around or resection of muscles. Right? Anybody know the name to that case? All right. Strabismus, and I'm going to fix your guys' terminology and how you use it. Strabismus is not the surgery. Strabismus is the, again, condition that's happening, okay? We do not call it arthritis surgery, right? We call it either a total knee replacement, a knee arthroplasty, because that's what we're doing. So we're not doing strabismus. We are correction of eye muscle or correction of strabismus, either muscle resection or muscle recession. Okay, those are the things we label on our case studies, guys. Okay, so we're gonna fix that starting now. There's we're good. There's we're okay. Okay, but again, we want to make sure we level things. Again, hysterectomy is nice, but there's different types of hysterectomies, right? Okay. So his case studies look good in the end. In the beginning, it was just hysterectomy. Alright? Okay. But now we place, again, we don't give the condition. We don't just put, what did you do today? Cancer surgery? No. Removal of mass, breast area. Removal of mass, bone, femur.
Rotation
What
plastic.
did you do? Again, you're giving me the surgery, not the condition. So strabismus surgery is not the name of it. It's, again, correction of eye muscle or strabismus correction. Surgical intervention, something of that sort. And in your case, what are you reading? Recession or resection of muscle. That's what you're doing, okay? So I'm gonna put this up there just so you guys can see it. Actually, let me take it out of there, out of rotation, right here near the sharps. You guys know not to play here, right? All right. So after the speculum and you open the eye, this is the speculum, right? Magically, it's a speculum like a barricure or an eye type speculum. The next thing the doctor's gonna do is either mark or have a holder in place. Again, this is where your 0.5s or 0.12s come in, and then your doctor's going to inject. So you're gonna have a smaller gauge needle, like a 30 gauge needle, on usually a half, a 0.5, or a 1 ml syringe. You're not gonna inject anything more than 5 mLs into the eye. Anybody know why we're not doing more than that?
You'll pop it. Too
Pop.
much pressure.
Okay.
Pop it.
Hopefully we don't pop it, but pressure.
Pressure.
Right.
It
If
could
you
cut-
pop the eye, that's a
could-
lot of pressure, but still.
Could it?
I mean, chances of that happening are rare, but yeah, if you put too much pressure, you actually start destroying the choroid body and retina in the eye.
I was gonna say it would like burst blood cells as well, like a
Yep. Again, what do you start doing? You start blocking off
supply.
vessels, angled glaucoma kind of area. That's where you get glaucoma when that stuff blocks off. So you're already doing this to the patient, you're creating more damage. So that's why we have tonometers and stuff after surgery to make sure the eye pressure is at its base, okay? So that's why we have the small type injector, so you don't make the mistake, okay? And it's easier to inject. Compared to having a 20 ml syringe is hard to inject, guys. Compared to this one, it'll also give you the bounce back in tight areas, okay? If you have a big one, you can also force things in. So that's why we like using these small ones, okay? So usually follow with some sort of injection. Your medications, hopefully you guys are listening to Dr. B's lectures, but lidocaine is one of the #1 things used to numb the eye, okay? You guys might get drops, and those drops are usually given pre-surgery. They use, again, myotics and mydriatics. You guys know those, right? So keep studying those. You guys remember what mydriatic and myotic is?
One for dilation, one's for restriction of pupils.
Do you remember which one's which?
The first one you said is for
Myotics and mydriatics. Do you guys know? Okay. Okay, so think of mydriatics, drying area. When something is dry, what? Shrivels up, right? So your iris is going to shrivel up, giving you an open area, actually dilates your pupil. It dries it up. So what does it do? It constricts back, giving you an open eye. Okay? So it opens up your eye. Okay? Alright. So as simple as that, just learn that. Alright. Moving on. Medication. Easily the ones you guys are probably going to be giving during surgery is going to be lidocaine. Again, mydriatics, myotics are usually given before the surgery. Okay? They're usually given at bedside before you start doing everything else. Okay? So you don't inject it like other things. You drop it into the eye and it soaks in. Okay? Alright. Next thing, we're going to need to cut right into the eye. So these are getting out of sequence already. So more than likely they're going to end up using a smaller blade, right? Like some sort of keratome or some sort of diamond knife. Okay. This is a good size right here, a 3.0. A 1.5 is too tiny. A 1.5 they might be using with some sort of vitrectomy. They'll make a small incision to inject a needle. So your 1.5s act like an 11 blade. This one here starts acting more like a 15 blade. Okay, as your, of course, beaver blade. But this one's more of an eye to get into the eye. 15 blade, and that one's more to get around the eye, 15 blade, okay? So don't give that one for in eye, and don't give this one for out eye. Sense? Yes. Simple. Okay. All right. So this guy knife, again, usually a keratome to make incisions into the cornea, so we can get into that anterior chamber, okay? once you get into the anterior chamber, what's inside, guys? What's inside the anterior chamber?
Lens.
Just automatically lens? Fluid, right?
Fluid.
We got some sort of fluid. What kind of fluid is that? Aqueous humor, right? Now there's aqueous humor. If we poke into it, can some of it come out? Right. Should we continue to replace? Yes. So on your field, you're going to have something like a viscoelastic agent. So you should have that ready. So have that ready. But before that, we might need to just evacuate that visco agent. So you might have something like BSS to inject into the eye to get the cavity expanded, like you guys do your belly. In the belly, we use gas. There's fluid in here, so we use what? Fluid. To evacuate and create a chamber, we use BSS. To replace, we use visco. Okay? So again, the doctor likes to go in there with BSS, expand, visco to lubricate. So be ready with those two syringes, and usually about 3 to 5 mL is what you want to have. Okay? The BSS you'll have to load yourself. Your nurse will actually come and drop some BSS on your field like you do your saline. Or you might get little bottles, little squeeze bottles like Visine bottles, which will have BSS inside of it. Okay? So if you have the little Visine bottles, the Visine little thing, they don't look exactly like Visine bottles, but they're little droplet. They will have also a lure lock, so you can load these irrigators or cystotomes. Okay? An irrigator is to simply go into the eye and irrigate. A cystotome is to go inside and start fracturing the eye along with hydrodissection if needed. Okay? So this guy will go into the eye, and this is a true cystotome because it has a small little hook on the inside. What that does is it goes inside, it's able to scrape along the lens and start creating a little valley inside of it. So this is sometimes doctors call it like a cracker. Let's go ahead and crack that in. I forgot the other name they call it. You guys, you remember the name?
Pecan.
They actually don't even know what it's called sometimes. Give me that thing. Cystotome, you can go with that, okay? So a cystotome or a fracture tome. The fracture tome is going to be the one without the syringe. The fracture tome is going to be something like this, okay? They have the same kind of technique. On the end is a little spike, on the end is a little knife. Fracture tome, cystotome. Why is it cystotome? Cysto is a fluid-filled sac. So this cystotome is a fluid-filled device that's going to go into a sac to cut. Tome means to cut. Cysto means fluid-filled. So what is this doing? A fluid-filled cutter, guys, to go into some sort of cavity. So these are both fracture tomes, cystotome to be exact, and this is your manual one. They no longer use this one. Okay? I'll have these next or available. Anytime you go into the eye and you work with it, continue to irrigate it. So make sure you continue to have a full syringe of BSS with your cystotome or irrigator, whichever your doctor needs next. All right, once he goes in there, again, he might continue to hold the eye open, and he's gonna work inside to now start chopping the lens. Whether he continues to use the cystotome, fracture tome, or now finally start going in with your ultrasound phaco emulsification unit. This is a simple ultrasound. This is old school, guys. Okay. This one you might need to switch tips. This one has a little probe or agitator, and it'll still suction and irrigate. So you can go in there and kind of clean up spaces, maybe even lift up, like you guys use your tenotomies, or you guys end up using your Metzenbaums or your tonsil schnitz to kind of dissect. Your doctor will use simple little things to kind of pull open and start dissecting. Once he's ready to cut, you'll need to switch to an actual cutter, which is actually this one. This one here is just a probe, okay? And sometimes it's a tester to test that the ultrasound is working. But you might need to switch to your actual cutter when you guys get a chance. Try to load it, and you'll see it has a little beveled end, so it can cut, water pulsate, and suction as it's going. This guy is going to chop your cataract into slices, almost like a pizza. It's gonna make several slices, so while doing this, you can't just go in there with the finger, right? Try to move things around. So you actually have some little device to go inside and continue to move as he's chopping, move, chopping, move, chopping, move. He's turning the pizza to make those slices, okay? Once he makes all those slices, whether it's a 4 slice, 8 slice, whatever. How do you guys like your pizza slices? 4 big giant pieces, yeah?
What?
So he ends up making pieces, right? And then again, and a lot of times, guys, pay attention to the video and what's going on, so you can be ready to give him the next instrumentation. He's in a microscope. You guys should have a video. So please ask your nurse and your residents that you need the video for the procedure that is on hand. Well, I need to watch surgery. I need to perform with the surgeon this surgery. So please give me some sort of monitor. I don't know how many times I have to fight for that. You know, I don't know what he needs next because I can't see anything. He's under a microscope. So make sure they have some sort of viewing device for you guys. So that way you could know whether he's done and needs to irrigate. Again, once instruments come out, what do you do again? Either BSS or Visco. Depends on your doctors. Some doctors love BSS. Some doctors love Visco. Lucky thing with Visco nowadays, and that's what the company calls it. It's a visco elastic agent. They come pre-made, pre-ready. Literally, it'll be a syringe filled with Visco, and it'll say Visco on there. All they do is drop the whole package. All you got to do is load cystotome or irrigator tip to it. So do you have to label that? No, it's already pre-labeled for you. If it wasn't labeled, please label it. I have doctors that wanted 10 cc's of Visco, so you have to label it Visco. Okay? Because that's all he used during surgery, just one. All right. And then moving along, again, guys, you might have to change tips. If you're old school, you have to change tips, but everyone's got the new phacoemulsification unit. And that one is a one-time piece. As soon as he goes in with it, he just changes the setting. Dissect, settings, chop, settings, aspirate, settings, polish. And it'll do everything for you. Back in the days, you have to switch out your tips. Okay? So the tubing is going to be different, but it's something similar to this. And then it has a cartridge that you'll hand over to your nurse. And you'll see a cartridge type thing in those packages. And it applies to a machine. That machine also has a little tiny MAYO stand. Okay? It's pretty cool. It's like a little arm that comes out. And it has for little pouches. And all you got to do is apply one of those plastic sheets or a MAYO stand itself. Okay? Check with your facility. Again, I need to get with OSC more so I can see if I can get some of their stuff for eyes, because I know they have a lot of canceled cases too. Yeah. So then as you go, you probably shouldn't need this for a cataract surgery. You shouldn't have to close the eye. Okay. Again, why don't we close the eye? It's a mucosal lining. Okay. If you guys knew, mucosal linings do what when it heals? Fast. It heals fast. Mucosal linings heal fast. So if we put sutures there, it can more than likely cause more irritation. So how do we correct that? How do we close that little flap? Wexel. All the doctor does is tell you drop some more BSS. You know, go ahead and grab that flap and I'm done. Okay. They'll of course put a dressing on you to make sure you don't continue to touch. But since this is a mucosal lining, within a few hours it's going to go ahead and start healing itself. So you don't need to suture. If you made big incisions, then you'll definitely need to start suturing. Okay. Then be ready with your lens. We talked about your lens, right? Having it ready. This one is nice because I'm gonna flip it and it'll actually go, oh my goodness, it's the wrong way. Don't do that. Ivan scared me. Good job, Cheryl.
I can actually see it on the video.
Whoa.
It's shiny.
So if you guys want to take a look at it, it's gotta be in the package. You see how small it is. This thing just popped open.
All by itself. Nobody was even touching it.
What part was it in? What part was it in?
In here.
And it just popped off?
I think I gotta be more careful with it next time. Yeah, just. It should have. Yeah. It's not even like. Super tiny, right?
Like a little, it's like half an inch. Not even like a quarter of an inch.
Do we have the little injector thingy? I think we had. Huh? I didn't break nothing. It failed. Contaminated. I contaminated.
He's demonstrating, you know, what would happen.
If it popped off, could you just ask for another one?
If it pops up, you better make sure they don't take it from your check. These things are expensive. This is an implant. It's stays in. So this patient paid big money to have this implanted so they can see now. This is an internal glass, guys. It's an internal prescription for the patient. Okay, so what happens if you give, like we talked about, if you give the wrong one, your patient's gonna say, why is my vision bad? Okay. Some of you guys have glasses, try turning your glasses around. Vision might be totally different because if you have different, again, diopters and stuff going on, you're not gonna see correctly, okay? So this guy right here, literally, you're gonna grab, again, you have this little lens inserter. You're literally gonna have to flip, put it into the little device, and then push it in, okay? There's a little pusher right there. I hate moving, man. Okay. And then after that, they'll insert it and then follow with visco, blah, blah, blah. And then continue to close with these guys, okay? So again, we're probably gonna break this down. I don't think we have time to do the whole thing. We'll try to practice it on next Tuesday. We'll come and practice it and then we'll go into ENT draping. That's the biggest thing we're gonna do. ENT draping and possibly some tonsils for that Thursday, no? It's not this. It's not this, but it looks something similar to this, guys. Where this is an injector, you'll load it back here, close it, put it onto another device, and the device will squeeze it out. You can see there's a little like opening in the end. There's a little opening in the end where it'll come out. This is not the exact one, but it looks like this. It'll literally be a little round. Yeah, you'll slip it in. You'll literally have to slip it inside. It's about this small. It's about this small because it needs to go in that little hole, and then the device will push the little lens in, and it'll put a tortilla out. So, all right, take a look at it, and that's about it for today. So, again, Calibri forceps, 0.5s, fracture tomes, cystotomes, diamond blades, injectors, and speculums is the main thing. Now, surgical tech, this is what I want you guys to leave with today. We talked about BSS and how important it is, right?
Yes.
What are you guys doing for most of this case?
BSS.
BSS. You're
BSS.
irrigating about 5 to 8 seconds. Every 5 to 8 seconds, squeeze, 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 squeeze. Instrument, please. Here you go. Squeeze. Squeeze. Okay.
So
Now, you do not squeeze if the surgeon is doing something. So you gotta time, that's why I said 5 to 8. If you're going above 8, then you should be ready to go, oh, hurry up. I'm not there. It's already going, your eye is starting to dry up. Remember, it's kept open, there's lidocaine in it, so it's not doing its normal, again, blinking and fluid, so you have to be that person. Okay, yes.
how much are we gonna squeeze? Amount are we about to ever going to squeeze it?
Just to
every
get
time?
the whole eye circumference wet.
So not a lot, like at one time.
Boom, just a little squeeze. You'll see, this thing can squeeze out a good distance. Because if you go in with the whole thing, if you didn't have this little squirter, then you have to go in closer. Also, remind you guys why we don't do this while the surgeon's operating. This might look like a little squeeze. Under a microscope, it's a tsunami of fluid, okay? So what you want to do is just give enough to when he's not truly working in the area. If he's working, readjusting, squeeze. Working, he's gonna keep on working and readjusting. Try to find those readjustment periods so you can squeeze. You don't want to squeeze again. It's a tsunami, okay? So you want to just really quick, as quick as possible, squeeze. There's times where I missed too. Oops. Try to squeeze as soon as you can, okay? So it's 5 to 8 seconds, not 5, 1, 2, 3, 4, 5. It's squeeze, 1, 2, 3, 4, 5. Oh, he's working. 6, 7, 8. Okay. So you want to keep the eye lubricated. If you don't make it, please don't feel like a failure. I'm at 9 seconds. No, it's you want to have a continuance of the flow. You want to keep that eye as wet as possible, and that's why why BSS is so important, guys. If you don't keep that eye lubricated, the cornea can start getting damaged. You can easily scratch it, and if you don't know, if you scratch a cornea, you're considered, or you get a portion of blindness. You are now a portion of being blind. And if we cause that, it's just like removing the wrong leg. It's just like doing wrong side surgery. It's just like not doing a procedure as you should. The patient can sue for that. So we need to continue to keep the eye wet as the surgeon operates, okay? All right. And again, we'll try to come back. I'll set something up so that we can work under a microscope and you guys can pass these without, again, being able to see and hold these and kind of work with something. Yeah, I'll see maybe this weekend I'll create a microscope. I created a microscope. Go pick it up in the room. I made a whole microscope. And I'll see if I can do it again. All right, so take a look at it. Again, basic cataract surgery. Compare it to what you guys will see when you research. For real, there's real setups out there. Please continue to research, and you guys will see the setup. I think I have a picture. So for the next few minutes, guys, please take a look. Take a look at the MAYO stand. If you pick it up, please put it right back. I'm gonna see if I can find some.
So, I had a quick question though. On the lens, what are the blue wires protruding out of it?
Those are the little arms that hold it in place.
In the eye?
They like stick out and anchor it in.
Oh, okay.
Same here, guys. I have this is an actual eye setup that I have. Cataract. You guys can take
Real life?
like real life.
Airdrop it.
The ones that you see over here that are plastic are safety eye blades, where it has a retractable blade.
Why are they labeled like bright yellow?
Bright yellow?
Yeah.
So you can actually see the medication. Some people have bright blue, bright yellow, or just a simple white.
Okay.
I have a bunch of surgeries. I got
Keeping all these secrets